Good morning. I'm Dr. Casey C. ASMR. I'm here to do your physical examination, focusing on your cranial nerves and head to ensure that your eyesight is okay. Checking senses, doing some tapping. Thank you so much for choosing me to be your doctor today. We will begin in just a few moments. I ask that you get comfortable. Close your eyes. We'll begin with a few deep breaths. So first, we'll begin with an inhale for 3 seconds. Hold for 2 and exhale for 4. We'll begin now. So if you were able to count while you were breathing, it would have sounded like 1, 2, 3. Hold 1, 2 and exhale. 1, 2, 3, 4. The reason for holding our inhale and then exhaling longer than we inhaled is because it requires our body to regulate our lungs. When we breathe like that, it makes our blood pump faster and our body regulates to slow everything down, and which actually puts us in a relaxation mode. So breathing exercises are wonderful. I highly recommend. So we'll do a few more of those. Let's say 2 more times. Good job. And one more time. I hope you feel relaxed. I definitely feel relaxed. I think that it would be beneficial if we actually did it 2 more times. So again with me, inhale for 3, hold for 2, and exhale for 4. Our body is beginning to relax. We can just lay or sit in a comfortable position, whatever you prefer. We will begin our exam. Please go ahead and relax by closing your eyes. And we will begin now. We will begin with an eye test. I'm going to draw some shapes. Let me know what shape you see. Can you see this shape? What shape is this? A heart. Was that hard to see, or were you able to see it clearly? Absolutely. I drew another heart. Please tell me which one is bigger. We have 2 hearts. Is the top heart larger or is the bottom heart larger? The bottom heart, good job. I drew something else. You can see it here. What did I draw? A flower. I attempted to draw another flower. Please tell me, is the top flower smaller or is the bottom flower smaller? The top flower is smaller. Can you see this shape here? What shape is this? A square. Now please tell me, is the top square smaller or is the bottom square smaller? The top square is smaller. Here's another shape. What is this? A star. Is the top star larger or the bottom star? The top star is larger. And what is this shape? A triangle. And which one is larger? The bottom triangle is larger. What is this shape? A rectangle. And which rectangle is smaller? Yes, the bottom one. We are now going to do a color test. I will do a color and you will just let me know what color you see. What color is this? Purple. That is correct. And what color is this? pink. What color is under the pink? Green. This color? Orange. Good job. What color is this one? Brown. Red. Blue. Good job. We're almost there. Just a few more colors. Can you identify this color? Green. Was there another color that was the same or similar? Yes, this one here, the third one from the top, this was also a green like you said. Good job. What is this color? Yellow. Good job. And two more. Can you tell me this color? Black. Yes. And last but not least, what is this color? Gray. Yes. Can you tell me again? This color? Red. Purple. Yellow. Yes. Pink. Good job. Awesome. So when you look at purple, what do you feel? You feel light? Awesome. Like a breath of fresh air. That's beautiful. I'm going to put light. When you look at this color, pink, what does pink make you feel? Makes you feel bubbly. I like that. I will write bubbly above the pink. does forest green make you feel like? Down to earth, grounded. Yeah, absolutely. I'm going to put grounded down. That's a really good word. In the next color, orange. How does orange make you feel? Cautious. I could see that. And brown. What does brown make you feel like? Like you want to lay down, lie in bed. Like a day to watch movies, so relax. Absolutely, I can see that. How does this color, red, make you feel? Mysterious. Ooh, okay. How does blue make you feel? Tranquil, like water. And this green, how does that make you feel? Growth. That's a good word. How does yellow make you feel? Happy. Could you tell me how black makes you feel? New beginning. Makes you feel neutral. Because it goes with everything. Black does go with everything. It's a good go-to color. Pair with everything. And gray, how does gray make you feel? Foggy? Like when you have a brain fog. Yeah, absolutely. Is that how you feel when you have the headaches? Yeah. Using stickers, please go ahead and tell me what you see. What is this sticker? 1. This sticker, an @ symbol. sticker? Coffee? Hot cocoa? Do you know what this sticker is? A paper clip? Yeah. What is this sticker? The dollar sign, yes. And this one? A question mark. What color is this? Green. Blue. Yellow. Purple. It's like a faded blue, I guess. Yeah, I could agree with you. Pink. This sticker? A thumbs up. And this sticker? A heart. A plane. Makes me want to travel. Weights. Go to the gym. A shopping cart. An X, yes. And this one, a star. Perfect. You did great on your eye exam, and also using your emotions with that, bringing all the sensory together by feeling, by seeing. So that's awesome. You will go into a smell test. I'm going to put some lotion on. Tell me what it smells like. Can you smell that? What does that smell like to you? Like honey? Okay. It does have honey in it. What else does it smell like? Like cocoa? Yeah. Like cocoa like the chocolate? Or cocoa like coconut? Like the chocolate. It is actually cocoa honey, but it is the coconut, not the cocoa, like the chocolate for hot coffee. That was really good. Now I have a candle. Go ahead and smell the candle. It's a really good smelling candle. Your turn. Smell it. What does that smell like to you? Flowery? Okay, yeah. What else do you smell? Okay, like a fruity. So it's coconut and iris. Very good. It's hard to distinguish when there are two different smells with one. So the fact that you're able to at least pinpoint one of the scents from the smell is really encouraging. I don't think you have anything clogged that could be causing any pressure for the sinuses. So I don't think it's causing headaches, but it's really good that you're able to do that. We're going to do a hearing test. I'm going to move them around. Just let me know if you can hear it on the left or right. Right. Left. Left. Right. Right. Left. Right. Right. Left. Right. Left. You're doing great. Good job. Right. Yes. Left. Yes. It is right. Yes. Now just listening to the sound. Really just trying to tune in the movement. Does that make you feel relaxed? Good. Using this comb, I'm going to brush against the small bristles and the large bristles. Please tell me which one you're hearing. Yes, the small. Yes, the large. That is the large, yes, good job. Yes, the small. Yep, the small. Yes, the large, good job. Next, we're moving into soft or hard. Soft or hard. Tell me which one. Soft. Good job. Don't forget to keep your eyes closed, okay? And which one now? Yes, hard. And now? Correct. Soft. And how about now? Soft. Good job. Yes, hard. Correct. Soft. Do you think it's going fast or slow? This is slow. And this is fast. Ready? Which one do you hear? Fast, correct. Slow, yes. Fast, correct. Yes, slow. And now? Fast, awesome. Slow, good job. And one more test. We're going to do a feeling test. Please let me know if it's sticky or hard. Yes, hard. Yes, sticky. Hard. Sticky. Hard. Good job. Sticky. Hard. Hard. Good job. Sticky. Hard. Good job. I'm going to check your temperature. We want to ensure that you're well. When our body has a high temperature, it can put us off balance and hurt us or harm us. So we always want to maintain a temperature within normal range. I will put batteries inside of my thermometer. We are setting the time. You have a good temperature. It is at 98.7, which is within normal range. I will now begin to take your blood pressure. Your blood pressure looks really good. It currently stands at 115/65. Let's check your oxygen. Oxygen at 97%. That's really good. That means that the oxygen is flowing through your body very well, which means your blood vessels are doing what they need to do. You're breathing well, and it's reaching your extremities. I will go ahead and listen to your lungs, since we're already talking about oxygen. And what I'm trying to hear is for any muffled noises, anything that sounds irregular when you're breathing. I'm sure we have no concerns. I know you said that you haven't had any sharp pains. Your oxygen level is really well, and you don't have shortness of breath. We'll just double check as part of our evaluation. As I do this, please go ahead and make sure you take 3 deep breaths and relax as you're doing so. You may begin. Your lungs sound great. There are no concerns. Now we'll go ahead and head into your heartbeat to make sure that everything sounds great there. I see no records of heart murmurs or anything to be concerned of, but of course it is always great to always check. Per usual, we hear S1 and S2. No S3. No murmurs. Your heart sounds great. Glad that we were able to get in those vitals themselves. We will begin with an eye check. And before we start, I just want to make sure that you don't have glasses or contacts per your records. I didn't see any. And that's great news, because a lot of times when you do, it is noted on your driver's license that you do need those things. Have you had your eyes checked at any time within the last 2 years? No? Okay. So just at a regular doctor's office, which is fine. A lot of times we will evaluate here in office, and if we don't deem any concern, then you're good to go. If we do find some discrepancies, then we will refer you to an eye doctor or an ophthalmologist, and then they will do further evaluations to see what it is that you need in regards to ensuring you can see clearly and safely. So what I will do first is put some gloves on, so please go ahead and relax while I do so. Before we begin any eye chart or anything, I would just like to check your peripheral vision to see when you begin to see my fingers. So I'll have my two and I'll just bring them in and just say now, and then we'll just kind of go in a big diameter of a circle until we can see your full peripheral vision, okay? I'll be now begin using 2 hands, going from opposite sides. If you see them at the same time, say now. If they're at different times, then say now, now, okay? Now that we did that, again, continue looking straight ahead. And I will hold up some fingers outside of your peripheral vision. Please let me know if you can see what those numbers are on my fingers, okay? One. 2. 1. 3. 4. Yep. Good job. Doing really good. 1. 2. 3. 5. Do it a few more times. You've been doing really good. Your peripheral vision seems to be on par. 2. 3. 5. Good job. Okay. I would just like to go ahead and look at your pupils. Just make sure that they're dilating correctly and functioning as they should be. So go ahead and continue to look in a straight line and don't look away. Okay. Your left eye is dilating quite well. I'm going to check your right eye. Beautiful. Your right eye is also dilating as it's supposed to. Now I'm going to some crazy zigzags and crazy things with my light. Please make sure that your eyes stay straight forward, okay? Perfect. I have the eye chart that you will begin to utilize now. I want you to close your left eye, and I will have you read a line going from the left to the right. So go ahead and close your left eye. Thank you. And then please read. Let's start with this line. What is this? Very good. And then this one. Very good. And then let's see if we get one more. Very good. And what is this color? And this color? And what number is this? What number is this? And which number is the larger? Perfect. Go ahead and uncover your left eye, and now cover your right eye. Very good. We're going to go through the same lines, but we're going to do it backwards. So right to left. Starting here. Good. Very good. That's fantastic. Good job. So it looks as though you still have 20/20 vision. Here's the numbers here. 20/20. Keep that eye closed. And let's do this. What is this color? What is this color? This number. And this number. Very good. And which one is smaller? Correct. I would like to go ahead and check your ears just to make sure that you're able to hear everything well. So if you can go ahead and look this way for me. Okay. So that ear looks really good. I don't see any redness, no inflammation. Eardrum looks healthy. There's a little earwax, but that's completely normal. There's nothing clogged in there, so that's our main concern. Go ahead and look the other way for me. Okay, perfect. That ear also looked really good. It did have a little bit more earwax buildup, but that's okay. Sometimes, depending on how you sleep at night, one side will build up more compared to another side. Completely normal. Just go ahead and use Q-tips and just make sure you're going around the ear. You never want to just push back because that's how you get the wax clogged in the back, okay? Since we checked your ears and they look good, I would like to do some sound checks. So I'm going to whisper some words. Just go ahead and repeat them after me. Strawberry. Blueberry. Very good. Now I'm going to do another noise. I'm going to have a sound 1 and sound 2. Let me know if sound 1, which will be the first noise you hear, is closer or farther, or if it's sound 2. Okay? So we'll begin first. What is closer? Sound 1 or sound 2? Very good. Okay. Do that again. Which sound is closer? Sound 1 or sound 2? Okay, we'll do it a few more times. Okay. Very good. Now we just want to make sure that you are hearing it from both ears. So we'll begin with your right ear. And I'll do it a few times. Just shake your head yes if you can hear it. And now we'll go to your left ear. I'm going to take a look inside of your mouth to ensure that there's no signs of any infection, any mucus that might be draining, no signs of cancerous cells or anything like that, nothing abnormal. So go ahead and open wide. Say ah. Okay. I'm going to move your tongue to the right. Okay. And I'm going to move your tongue to the left. Perfect. Move the tongue up. Take a look in the back again. Okay, perfect. There are no abnormal sightings. And while I was in there, I did take a look at your teeth as well. They do look fine. I didn't see any dark spots, which is good. So as long as you're keeping up on your every 6-month appointments and ensuring that you get fluoride and x-rays, then you'll be able to keep up and maintain your teeth, as well as brushing 2 times a day for 2 minutes each time. Brushing and definitely flossing. Never forget to floss. It is the most important. We always get food stuck between our teeth, and that's how a lot of the cavities form. And even on the surface of our teeth too. So just giving you some insight there, okay? going to go ahead and check for any bumps on your face using my other depressor. Okay, no bumps. I do see just some normal, what looks like acne. So I'm just going to take a closer evaluation of your face. If my light would allow me. Yep, just acne here and there, only a few spots, so no concerns. I don't think you need a dermatologist. Just go ahead and make sure that you are washing your face at least once a day. Twice is always better, just like brushing your teeth morning and night. But if you are only doing it once a day, definitely nighttime. And always ensuring that after you wash with a cleanser, use cold water to remove the cleanser, pat dry with a cloth or a towel, and apply lotion that would work with your skin type. If you have dry skin, you may want to use something that has a little bit more oils to help accommodate. If you have normal skin, definitely just use a normal lotion. Sometimes too much oil will cause more acne. Being too dry will just cause you to break out as well. And if you have oily skin, then it may help to find something that would keep it a little more dry to control the oiliness. I'm going to take some measurements of the face. All your measurements are symmetric, so no concerns there. Let's see. I like to go ahead and do some tapping just to see that everything on your face is having natural reflexes, okay? So we're going to begin that now. Okay, all your reflexes look normal and are responding really well, so no concerns. I'm going to move into a sensory brush to ensure that tiny nerves are responding, and also just kind of brush it through your hair so we can look at like the scalp and stuff. And to finish, I'm going to use these beaded wands to just continue relaxing the muscles around your face and to end your session today. Okay, that concludes our session today. You have another great exam, so we'll see you in probably about a year. Just give us a call and we can schedule an appointment to have it done again. Continue doing what you're doing, and I assume that all your other appointments will be just as splendid as this one. So don't forget to put your notifications on. That way you can be alerted for the next appointment. This is, of course, only the cranial exam, so you'll want to ensure to schedule your full physical and your dental appointments and everything else, okay? So notifications on so you can get those alerts. Thank you for being here again with Dr. Casey C. ASMR, and I look forward to seeing you at your next appointment.